Welcome to week 3 of pregnancy, an exciting time when fertilization is taking place and your baby is starting its miraculous journey of growth. In this video, we'll break down the symptoms you might experience during the 3rd week of pregnancy, along with practical steps you can take to support yourself and your baby. Whether you're trying to conceive or already suspect you're pregnant, this guide will help you understand what's happening in your body. During the 3rd week of pregnancy, something amazing is happening: fertilization. The sperm meets the egg, and a zygote forms, which will soon begin dividing and multiplying rapidly. At this stage, your baby is a tiny ball of cells, smaller than a grain of rice, making its way down your fallopian tube toward your uterus. While it's still very early, some women may start to feel subtle changes as their hormone levels begin to rise. Let's take a look at what symptoms you may experience during this pivotal week. In week 3, many women may not notice any symptoms yet, as the fertilized egg is just starting to implant into the uterine lining. However, some early signs may begin to emerge as your hormone levels shift. Here are some common symptoms you might experience. As the embryo implants itself into the uterine wall, you may notice light spotting. This is often confused with the start of your period, but it's one of the earliest signs of pregnancy. You might feel light cramping in your lower abdomen, similar to period cramps. This is due to the implantation process and early changes in the uterus. Hormonal changes can cause slight emotional shifts, even this early. You might notice feeling more emotional or irritable. Your breasts may start to feel tender or swollen as progesterone and estrogen levels begin to rise, preparing your body for pregnancy. Feeling unusually tired? Your body is working hard to support early pregnancy, so don't be surprised if you start to feel more fatigued during this week. Although it's still early, there are important steps you can take to support a healthy pregnancy. Here's what you can do during week 3. If you haven't already, now's the time to start taking prenatal vitamins with folic acid. Folic acid is essential for your baby's early development, particularly for preventing neural tube defects. Focus on eating whole foods that are rich in vitamins and minerals. Leafy greens, whole grains, lean proteins, and foods high in calcium and iron are great for supporting both your health and your baby's development. Hydration is key during pregnancy. Aim to drink at least 8 glasses of water per day to help transport nutrients and keep your body functioning optimally. Make sure to avoid alcohol, tobacco, and excessive caffeine during this time. These substances can negatively impact your baby's early development. Be mindful of how you're feeling. If you notice any unusual symptoms, such as severe cramping or heavy bleeding, consult with your healthcare provider right away. Whether you're trying to conceive or have just discovered you're pregnant, there are some things you can do to boost your chances of a healthy pregnancy. Tracking your basal body temperature can help you confirm ovulation and better understand your fertility window. A rise in temperature can indicate that ovulation has occurred, which is key if you're actively trying to conceive. Light to moderate exercise, such as walking or prenatal yoga, can help keep you active and reduce stress. Avoid high-intensity workouts during this delicate time. Stress can impact your hormone levels and affect your chances of conceiving. Practice relaxation techniques like deep breathing, meditation, or gentle stretching to manage stress. If you're trying to conceive or suspect you're pregnant, schedule an appointment with your doctor to discuss prenatal care and any necessary lifestyle adjustments. Let's clear up a few common misconceptions about week 3 of pregnancy. In fact, week 3 is a crucial time. This is typically when fertilization and implantation occur, so your chances of conceiving are highest right around this time. While it's possible to get a very early positive test result during this week, many pregnancy tests won't pick up the hormone HCG until week 4. It's best to wait until after you've missed your period to take a test. Some women don't feel any symptoms this early, and that's completely normal. Every pregnancy is different, and symptoms may start to show in the coming weeks. Let's wrap up with a few frequently asked questions about week 3 of pregnancy. What should you avoid eating during week 3? Avoid raw or undercooked foods, unpasteurized dairy products, and fish high in mercury. These foods can increase the risk of infection or harm to your developing baby. When can you take a pregnancy test? While it's possible to get a positive result in week 3, it's best to wait until week 4 or later, when HCG levels are higher and more detectable. Can stress affect your chances of conception? Yes, high stress levels can impact your hormone balance, which may make it harder to conceive. Managing stress through relaxation techniques is important for overall reproductive health. Week 3 is an exciting and delicate time in your pregnancy journey. Whether you're experiencing symptoms or not, know that your body is working hard to prepare for the months ahead. Focus on eating well, staying hydrated, and reducing stress to give both you and your baby the best start possible. Thank you for watching. If you found this video helpful, make sure to subscribe for weekly updates on pregnancy symptoms, tips, and advice as you continue on this incredible journey. And don't forget to share this video with other moms-to-be.